Welcome to another sample question of the Boston Echo Board's review course. This is an important sample question because it relates to ultrasound exposure and tissue safety. As usual, there'll be a STEM question that'll be followed by 4 choices. You'll have about 30 seconds to make and identify the correct answer. The correct choice will be highlighted, and following that, there'll be discussion regarding the concept presented in that question. Keep an eye on the clock because it's only 30 seconds. Have a good time and good luck. So the correct answer is C, which means cavitation is related to the peak negative pressure of the pulse ultrasound. Now let's get into the detail of this answer. So cavitation is defined as ultrasonically induced activity in tissues or body liquids that contain bubbles or pockets containing gas or vapor. Importantly, cavitation is produced during the peak negative or the peak rarefaction of the pulse ultrasound and not during the positive. That is intuitively what seems to be the answer. So all the other questions that relate to cavitation, I have put them in a kind of presentation to summarize and make it easy. So there are technically 2 different kinds of cavitation. The first is stable cavitation, that is with vibrating gas bodies. The gas body continuously pulsates, that's a small bubble, around its equilibrium size. The liquid medium around the body as a result of this continuous and high-frequency oscillation begins to stream, and that is referred to as microstreaming. Now, it has been shown that in experiments that this microstreaming can lead to disruption of cell membranes. The second type of cavitation is inertial cavitation, in which pre-existing bubbles expand and collapse in response to a rarefactional pressure. That eventually leads to an occasional violent implosion. This implosion can damage cells and cell membranes and can raise the pressure to multiples of the atmospheric pressure and significant rise in temperatures also, with simultaneous release of chemical molecules that can damage tissues. However, fortunately, this inertial cavitation and implosion occurs over a very small area in the range of only 1 micrometer cubes, which means the effects are not that well established and they do not cause that much tissue cavitation. So both stable and inertial cavitation cause certain effects during diagnostic ultrasonography. Also, I put them in kind of a question and answer format. So does cavitation occur clinically with the use of diagnostic ultrasound? Unfortunately, it does. However, fortunately, the answer to cavitation is the threshold phenomena, which means unless we exceed the exposure by a certain threshold, there is no cavitation. Now, does cavitation occur in human solid tissues during diagnostic ultrasonography? Well, there's no clinical evidence that ultrasonography in the diagnostic range causes cavitation in human tissues in the absence of bubbles. But like I said before, that the impact is so minuscule and so small on the tissues that it may be happening and we may not have noticed it so far. So it is not fully established. So does cavitation occur in human tissue with contrast agents? Yes, it does. And that's the point, which means when we are using contrast agents with bubbles, we need to lower the mechanical index and the ultrasound output to reduce cavitation with possibility of tissue damage. To summarize this thing, I have put together this report from the American Institute of Ultrasound and Medicine that relates to bioeffects of diagnostic ultrasound with gas body contrast agents. That was published in November 2007. What it states is that induction of premature ventricular contractions, microvascular leakage in petechiae, glomerular capillary hemorrhage, and local cell killing in mammalian tissues in vivo have been reported and independently confirmed for diagnostic ultrasound exposure with mechanical index above 0.4 and a gas body contrast agent present in the circulation. Now, this is important clinically that imaging with contrast agents at mechanical index of more than 4 practitioners should be used the minimal agent dose, minimal mechanical index, and examination time consistent with efficacious acquisition of diagnostic information. In addition, the echocardiogram should be monitored during high mechanical index contrast cardiac gated perfusion echocardiography, particularly in patients with history of myocardial infarction of unstable cardiovascular disease. Therefore, the threshold mechanical index where cavitation begins to happen is 0.4 or more than that. So the question to answer is, if the bubbles are not present, there will be no cavitation, right? Well, unfortunately, no, it happens in lungs. Animal studies have demonstrated that there are small areas of hemorrhage in alveoli that are self-healing and appear to be of no consequence. The threshold rarefactional pressure required to this effect is higher at higher frequencies, which means the higher the frequency, the higher the threshold that will be required to cause tissue cavitation, and lower for longer pulse durations and exposure times, which means the longer the exposure, the lower the frequency, the higher likelihood of having cavitation. And consistent application of a Larard principle, that is, as low as reasonably achievable, is the most prudent mechanism to avoid cavitation. Now let's get to the point in saying, what is mechanical index? The mechanical index denotes the potential for mechanical bioeffects of ultrasound. It increases as the peak negative pressure of the pulse ultrasound increases. It decreases as the ultrasound frequency increases. Mechanical index is a composite of peak negative pressure and frequency and demonstrates the potential for mechanical effects.